the fact that AI can help reduce mental load and not add to it. You can use AI safely, simply, and on your own terms. Practical AI creates more space for life.
I'm Dr. Kelly, OMD, your board certified OBGYN and healthcare executive, here to help you live your healthiest and wealthiest life. And the way that we do that is we bring on subject matter experts, which we have one tonight, to help you in your 5 pillars: spiritual, physical, financial, mental, and emotional. And in doing that, we focus on 5 things. We meditate, journal, exercise, optimize our nutrition, hormones, and sleep, so that we can be our healthiest and wealthiest self. You may wonder, what does AI have to do with that? Well, guess what? We're going to tell you tonight. So Dr. Tom, tell us a little bit about yourself, and then the top 3 things you want us to know by the time we leave this webinar.
Okay. Hi, everyone. I want to say I'm a software developer. I'm an epidemiologist. I did my master's in public health in London and my PhD in Germany, infectious disease. But you can call me also, I'm also a grill chef. I like to cook, and I do music. I play about 8 or 9 instruments, and I write songs as well. So in that space. Yeah, so the top 3 things I want us as 3 key takeaways today. One is the fact that AI can help reduce mental load and not add to it. And what I mean by that is, as you try to see AI as your working partner, and we'll talk about it in a minute, how we can reduce pressure and reduce stress when you can apply AI to what you do, your life and your work. The second thing is you can use AI safely, simply, and on your own terms. You don't have to have it control you, but you can basically control it. You can basically give it what you want and use it intentionally. We're going to talk about that as well. And the last one is practical AI creates more space for life, not more hustle, but more space for life. So those are the 3 takeaways I want you to get today. Over to you, Dr. Kelly.
Thank you so much. And I love that. First of all, I didn't even know that you played 8 different instruments, and I've been knowing this man for the past year. So I love the Renaissance man that we have here on our webinar. And, we're going to actually jump into it. Okay. So Dr. Tom, you told us a little bit about, so tell us a little bit more about, how you got to where you are. I love the story that you tell about what you wanted to be and how you got to where you are now.
Yeah. Okay. Many of you who know, I think this happens a lot in the African-American community, but I come from Nigeria originally. And my parents always wanted me to be a medical doctor or an engineer or a lawyer. And I was going the path of a medical doctor, but I know I'm a big guy, but I always had the fear of blood. And when I got into hospitals, I was like, nope, I don't think I want to, take care of patients that way. I want another way to help save lives. And so I went into software development and statistics and graduated with a double honor statistics and computer science and started to work as a software developer in a very good company back home in Nigeria. And for 8 years, I didn't have that satisfaction. It's almost like I'm building, but what's the impact? What's the social impact to what I'm doing? And I got an opportunity to work at the United Nations Development Program, supporting data that was moving, identifying health facilities to bring them closer to communities. And I had this epiphany, like, wow, I think I can contribute software development to healthcare and to public health. And instead of doing a master's in predictive analytics, which is what I wanted to do at the time, I switched and did a master's in public health in London, and then used that to understand how to build software for health. And I went to Germany for 5 years to do a PhD in infectious epidemiology. So I'm not an infectious disease doctor. I'm not. I just have a PhD in infectious disease epidemiology, but building software for infectious disease. And I've worked at CDC for more than a decade now, and Emory as well, but not taking care of patients, but basically running from one country and one continent to the other, doing outbreak response and building software along the way. I think that's a summary of my career so far.
And I love this because, you talk about you as a PhD, me as an MD, and the collaboration together brings forth that understanding of, what is going on globally Clearly,
Sure.
y'all can see global experience here. What's going on globally and how we're bringing that back to our communities, our nation, and making sure we have, tools that we can use for our healthcare. So one of the
Sure.
things that the way that Dr. Tom and I met is we're working on a project together for remote patient monitoring. And remote patient monitoring is when you actually can take your blood pressure, take your weight, as well as your glucose if you have diabetes, and it can go directly into your electronic health record. And a lot of people are like, oh, well, I can do that on my watch. It goes into my whatever app is on the watch. But imagine your physician actually getting that information directly to them, and you also have access. And of course, if you're a caretaker or being taken care of, that person can have access as well. So, Dr. Tom, tell us how you operate in this space in regards to remote patient monitoring.
Thank you. So, because of my background, which is a multi-sector background with statistics and computer science, and of course the healthcare piece, I'm able to look at a problem and try to identify what are the pain points people go through. So, once you're able to tell me what the pain point is, I'm able to detect a pattern and resolve that problem. And I wouldn't say it's a gift per se. I think I was just lucky to have this different experiences and this different educational opportunities, and then working in 3 or 4 continents to apply that skill set. So that brought me to a place where predictive analytics became my core focus. Even before the whole AI bubble in Germany, I was building, this was like in 2016 or so, I was building software and my computer was crashing. I was building models and my computer was crashing. And the reason was because um, there's certain things in life you want to predict, and you need a lot of data. And when you look at data retrospectively, what happens is that if you want to be like a time traveler and go back in time, which is what you do retrospectively, then you want to be a time traveler to go into the future, and that's what you want to predict. And the systems were not able to do that at the time. So we would write Python scripts and do modeling, and the computers would just crash. And so in 2021, 22, we started to talk about Gen AI. How do we use these things to help solve problems? And my focus turned to use that knowledge and build systems that solve problems, not just that you want to build a digital twin, which is what a lot of people are doing with AI. But
Mm.
we as health people were like, how can we take this and create some type of social and economic impact and health impact across the board? So yes, I build software now for predictive analytics to reduce emergency room visits, to reduce chronic conditions, so that people can know, like Dr. Kelly said, when you're taking your blood glucose and you have CGMs, or you have, taking your blood pressure, what you're doing basically is you are going ahead of the scale to basically stop any kind of disaster that would want to come. And when you have that trend, we call it trend analysis or time series, you can basically know when there's a spike or an outlier for you to basically reach out and save your life. So I think it's important in life. I think I like what you put here, less doing, more living. We want to do less, but do more living. And I think health is important to track our health. I don't know if I kind of summarized it.
No, that is absolutely perfect because first of all, I think anybody that can, master statistics and predictive analytics is way smarter than I will ever be. So thank you so much for doing that part for us. No, but you bring up that important thing. The title of this is like less doing and lit and have space to do more things that you truly want to do. So
Mhm.
that being said, I know that you told us that you were going to help us figure out how to create a personal assistant, and this is what I need. I think this is what many of us need, and I like the fact that you're like, don't create a digital twin necessarily, but create something that a person can actually, assist you in what you're trying to do.
Yeah.
So tell us about, how are you about to help me have a personal assistant?
Okay. So I will say this, and then I'll share my screen and quickly show you guys something on ChatGPT that many people might not know. This is just an assumption. First of all, the way AI has been set up, a lot of people have more or less, like, some people doubt it, and it's because of the whole buzz about AI. And what is AI? Is a question that many people ask. AI is artificial intelligence. You're looking at computers trying to learn from the human beings. And what I'm about to show you is basically an AI tool, ChatGPT, and you can say, I can ask it questions whenever I want to ask you a question, or I can use it to reduce the pressure load on my daily life or daily event. So I'm going to share my screen quickly, show you how to build a custom GPT and customize it to your personal assistant and use voice and a text, of course, to ask you questions to reduce your work. So let me share my screen.
And people, this is an action-oriented experience. And y'all know in VivaLife, we talk about taking action. So go ahead, Dr. Tom.
All right. So, okay. So you can see my screen. I'll give you a personal example. So as a Christian, I wanted to know how to study the Bible in a better way. And what did I do? I went to create, and I'm going to show you guys this here, the spoken word GPT. Was built by me. I wanted to understand how I could generate a podcast if I was talking about a topic called faith and works, or summarize a topic based on a particular book in the Bible, or create a dialogue between two presenters. I could basically just ask it anything, and that was what I was doing. And I went ahead to build something for Epidetect, which was basically when it first came out, I was like, how can I use this to detect outbreaks? And I built this in a way that I could ask it a question related to only the action. I didn't want to just ask ChatGPT questions because it's going to go to what we call a large language model. But I wanted to ask it a small language model, which only has the brain I wanted to have, which is what I'm about to show you. And so I built that, and for my company as well. Now let's do it together. So if you come to Explore, you should see Create. And this is a disclaimer, is that if you have a Chat GPT Plus, or you have some type of subscription, then you can do this. If you have the free plan, probably not. And I think it's $20 a month. So if you can reduce your pressure of life by $20, I'm sure that
Absolutely.
So, all right, let's hit the ground running. So you come to that. I'm doing it again. You hit Chat Explore, and then there's a Create right here. So you click on it. Dr. Kelly, we're going to use you as an example, and then you have this. That because of the Gen AI piece, you can type what you want here, and you will see the model being built here. So here we want to build a VivaLife personal assistant. All right, so I'm going to do this. Now, some people type, some people can use a dictate. So what I normally like to do is a dictate, and I'll show you what you can do with this. So if you use this, you can use that. There's some other options I use. So I'm going to use this and say, I want to create. This is what's called prompt engineering. Let me cancel this. So this is what's called prompt engineering. You have to be able to prompt the system. And I'm going to start with this. I want to create. First of all, you're the best personal assistant developer in the world. I want to create a personal assistant for VivaLife. And VivaLife wants me to do less and live more. So create a personal GPT that I can basically, that helps me with my recipes, that helps me with my medication adherence. If I have to take medications, that helps me with my kind of like my agenda for my daily and weekly activities. Let's stop there and do this. Okay. So I do that. And what's happening here is called speech to text. It translates what I put in on the voice to text. And I can review it and say, okay, I want to create, first of all, you're the best assistant in the blah, 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 down. I want to put that, and I say send. So what it's going to do is that Chat GPT 5.2 is what the model that's out. Basically, it's like a butler agent. What's a butler agent? A butler agent, if you have the idea of, how many of you watched the Fresh Prince of Bel-Air?
Oh, yeah.
All right. So you see the butler there. What was his name again? Blanking out.
Jeffrey.
Jeffrey, yes. So Jeffrey basically is a Chat GPT model that basically takes a task and implements it. So you already see where I'm going with this. It means that if you have imagine if you in your home right now, you have a personal butler that basically does everything for you, you're going to be relaxed. You see, So basically, this is Chat GPT, and it's a butler agent, is what we call it. Okay, so now it's giving me a setup, which is basically giving me a summary of what I said. Now, watch this. I just said something gibberish here. I'm sure I was not thinking about what I was talking about here. But the fact that it's a butler agent, it has the expertise to basically realign what I want to reduce stress in my life. And as a VivaLife companion, in fact, Dr. Kelly, maybe we're gonna take this a step further and deploy this in a real way for your community to basically use to reduce stress in their life.
Yes.
Effectively.
Yes.
Right. So if we say Viva Life Companion is the word we want to use, and we are okay with this, at least for these three items, then we are like, okay, thank you for that name. Let's go ahead. So I'm like, let's do it. And in the next 2 minutes, it's going to build out the custom GPT. And I'm going to show you how to load up files about yourself in there.
So just real quick, I'm going to pause for the cause here. So we had a great question. Number one, how do we know that the information that's being gathered is true information? And number two, how do we make sure that our personal information, if we're not comfortable, doesn't get out into the training model or back outside of our GPT experience?
Good question. All right. To answer that question, first of all, there's what we call a RAG, is reinforcement. I'm gonna remember the name now. It's a kind of brain or knowledge base that you can restrict your GPT. Remember, this is not Chat GPT per se. This is a model, GPT 5.2 model, but this GPT here is a custom GPT. It means that it's only going to know what you tell it. And that's what I'm about to show you. If you come to config here, you can name your GPT, you can put the description, and these are the instructions that you give that GPT. And it's only just instructions that it's going to follow. It's not going to go to the internet to get anything. It's not going to go anywhere. You can even put upload files. So when you upload the files, you're only uploading the files you want it to reach out to. Watch this. You can tell it you don't want a web search, and you can take that out. You want a canvas image generation? Yes. If you're like me who wants a code interpreter, you can put that in. You can put in actions, what we call webhooks, but I'm not going to go into that. But with this, you can basically come back here and say, I will create this, yes, and I will configure maybe 2 or 3 PDF files that have all the information I want it to concentrate on. That's one. So it's not going out to the internet. ChatGPT does not know what is there. This is just basically for you, for your own personal life, for your own personal stuff. And to answer your second question, every one of you, if you have ChatGPT, go to the settings and make sure that the allow GPT to train on your data is switched off. Let me say it again. Every one of you can go to settings. I can't go there now because I don't want to stop this process, but go to ChatGPT, go to settings, and then scroll down to, I think it's policy or privacy, and just say you do not want ChatGPT to train on your data. By default, is switched off, but it's important to check to make sure that it's not switched off. Okay, so let's see what's happening. Looks like the image. Okay, I don't want image. Let me just remove the image for now. Let's take this out and go back, and we create. Go ahead. I mean,
Now, you also mentioned, I don't know if you, I don't want to have you doing two things at one time, but you also mentioned there's some simple things that you and your family use in regards to this. So while maybe that's loading, if you want to, is it about to come back up? Let's see. Maybe you want
yeah,
to come back on camera and let us know while that's loading, what are some of the simple things that you all do in your home to help you make space for life?
okay. All right. So what I would say, I showed you 2 of them already. Uh,
Mm-hmm.
one was the Bible app that I did, which we kind of generate what we want for the family devotion and stuff. That's one. The second one is the fact that my kids, I have a 5-year-old girl, a 3-year-old girl, and a 2 months old girl. So I have 3
Yay.
girls. And my kids love to basically talk to the computer to basically say, hey, I want to build an ice cream shop, for instance. And
Mm-hmm.
because they always see me talking to my computer, my 5-year-old daughter will come and press the same button and start to talk to the computer. So what we tried to do was to build something, kids, and this is one thing all of us with kids go through. They can either be stuck watching TV the whole day or doing something that it's taking their time, or you can create some kind of interactive environment for them to basically learn. And that's what we did. It's almost like some of these learning apps. So what we did with ChatGPT, for instance, as an example, was to build something that the kids could interact with, which is both learning and fun for them. And a lot of times, I'm sorry to say this might be selfish. When I put them to do that learning, I'm able to, the pressure goes down for me to do. So I think that's a good way to kind of do that. But those are the two I showed, and because of time, the other one I have to set it up. But let's do this one. I think it's ready now, but it was trying to get an image in there. But you can basically also add an image by clicking upload photo, and of course there's no image there right now, but we can do this later, Dr. Kelly, to add an image. But this is the example, and I say create. And what I get is, this is the other thing. You can decide that you don't want other people to have access to it. You don't want to put it in a GPT store. You just want only you, because you want to put a lot of private stuff there that you don't want other people to have access to. Remember, you can put in your PDF files about yourself, and you would see this. So here, you could put, like I said, here, you can add a knowledge. I'm not going to add something there now, but anything you have, your resume, let me do this. If I put my
You could
resume,
probably, oh no, I was about to say you could probably take my website and put it in there, but it's not a file, so that wouldn't work.
yeah, I mean, we could, okay, we've taken out web search, so it wouldn't do that, but no problem. Yeah, so just because you want to keep it within the family and everything, you can
Hmm.
just upload files there about yourself, about what you do, about your schedule, your calendar, to put in there. And what this agent is going to do is going to learn everything it needs to learn about you. And then you can download the chat GPT on your phone. And then you can go to chat GPT and go to your GPT, your custom GPT, and that's where you need to ask your questions, not the general chat GPT. So here
Okay.
I can ask.
I love that. I love that. Let's see. We can stop sharing screen now. Bring
Right.
you back on screen. No, I absolutely love that because I just learned, I keep hearing about, creating your own GPTs, but me taking the time to create it, when I don't really know about it, I appreciate you coming on, Dr. Tom, and letting us know. All right, Viva Lifers. So this is the time where I want you to start asking questions. I know y'all are good about asking questions. You did not come on here not to learn something new. First of all, if you learned something already, please go ahead and throw a thumbs up or put it in the chat, whatever it is that you learned. But if you have questions for us, we want you to share those questions as well. So that being said, we're going to open the floor for you. You can either raise your hand, come off mute, or put it in the chat. And until you do that, I got more stuff for Dr. Tom. Dr. Tom. Okay, we're getting some thumbs up. We're getting some thumbs up. Many of these people are juggling a lot. They're juggling schedules, they're juggling family, they're juggling professions, everything like that. You just told us how to create a chat for like my business, but what about calendar management? So that's one thing I have a big thing about. How do you calendar manage or time block your life with these AI tools?
That's awesome. So there are different options, but I'm going to give you the first traditional one, which maybe some of you do, and then show you some of the AI ones, or maybe one example. The first one is, a lot of times, especially for those of you who work in a, like a standard industry, you're given like official emails and a whole lot of scheduling system around maybe Microsoft 365 and all that. And then when somebody puts in a meeting or something, you automatically get in your calendar and all of that. So it's easy to follow through. And when I started my business and started, my company, I found out that, you could do that, but a lot of times I started to miss what meetings I had because there was nobody doing that. And I started to use something, and this is going to be crazy. It's basically Siri. So what I do with Siri is, if I'm driving and a thought comes to me, or a meeting, or I just talked to someone, instead of me to wait till I get home to schedule, I'm just like, hey Siri, set an alarm and set a reminder to basically attend this meeting or schedule this or do something. I know many of us do that with the alarms, but this is crazy because when you tell Siri to do it, and then Siri basically goes ahead to do it, that's the first level of conversational UI, conversational AI. That Siri can now, because of the way Siri has, and many of you might not know this, is that Apple has decided as well to increase Siri's capability in terms of a conversational AI agent. But we still treat Siri as, hey Siri, what's the time? Hey Siri, what's the hey Siri, I'm not talking to you. So it's helped me reduce the pressure by 50%. I won't lie to you. I'm driving, I've talked to, hey Siri, set an alarm or set a reminder, and it just reminds me, and 50% the stress went down. The second one is called Motion.ai. When you have time, look at it, Motion.ai. If you're into you do your business, you're taking care of family, you're a mompreneur, you have so many things. Motion.ai basically helps. Let me put it in the chat. It basically helps everything, every aspect of your life, your business, your family, whatever it is, it controls. So it would ask you to connect to your calendar, to your email and all that, but it's not going out of your circle. It's basically custom built for that use, and it will just basically learn about your life and then help you out by even setting reminders and sending you. There's one that even calls you. That's a call agent, but many people don't pay for that because it's like on the enterprise level. But at least you can get reminders. You can get when you're in a meeting, it can listen to your meeting and then get the summary and then actually go to implement tasks. Like it's almost like a personal assistant as well, and then you can set your meetings and then set reminders and all of that. I would say that's one example. Siri for general life issues to basically help you with your calendar scheduling, but Motion AI is a combination of all of them at once. I would say
And
that's one.
I've had Siri off, but I think I might turn on Siri just to figure out how to get this going. And thank you for that other one, Motion AI. So we do have a question in the chat. As a teacher, I currently use Chat GPT for lesson planning. How can I use this personally to plan how to retire early or how to pay off bills earlier or, how to find all these subscriptions I have that I'm paying for and I have no clue whether or not I need to be paying for them.
The answer to that is in the custom GPT that we did. And I would just tell you by adding one option, web search.
Okay.
Basically add all your files, everything about you, all your activities and all, and then add the web search. So what will happen is when you go into your actual custom GPT, ask those questions. And when you ask those questions, it will search the internet and it will look at what you have provided as the brain, which is what you provided, and it's going to tailor every response to you and not a generic response. It's going to tailor every response to you. Try it, you'll see that it's going to make a whole lot of difference with regards to what we call positive predictive value, because ChatGPT is working on a huge, large language model. But when you build a custom GPT, what you've created is a small language model. It's called SLM. And many people don't know the difference, but they feel that, hey, but it's still ChatGPT. No, that's a huge 90% drop in hallucination. It's a huge 90% drop in, just basically giving you responses that you have to do 3, 4, 5 iterations. Like, no, ChatGPT, that's what I'm talking about. In fact, when you see me arguing back and forth with my voice agents, my wife is always laughing. It's like, is that your new girlfriend or something? Because I get pissed off. That's not what I asked. Come on. It helps a lot because when you now use a small language model, then it gives you exactly what you're looking for. Why? Because it's trained itself on the data you gave it, and it's only going to give you the output based on that data. So try it out with the custom GPT.
I love it. So, Dr. Tom-Abba, if we wanted to hire you for your consulting services, get in touch with you, what's the best way to do that?
You can basically go to my website at Jalabden. Let me put it, jalabden.com. It's a very simple Jalabden. And Jalabden is Joanna, my first daughter, Labby, my wife, and Daniela, my last daughter, combined. So it's jalabden.com. So if you go to jalabden.com, you will have my contact. If you hit the contact me, yes, you're going to directly contact me, and I'm happy to help in any way.
I love it. Thank you, thank you, thank you. And Viva Lifers, as you know, you can follow me on drkellyomd.com. Click all the links. You'll follow us on all of our social. This will be posted as a webinar in our website as well as on YouTube. All right, all right. Thank you, thank you, thank you for being a part of the Viva Life experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please, please, please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.